Welcome back to the Our Invite podcast. My name is Nima.
My name is Aaron.
And today we're joined by a very special guest, Dr. Scott Knoer, the CEO of the American Pharmacists Association, APHA. Thank you so much for joining us.
Thank you for having me, Nima and Aaron.
Thank you so much for taking time out of your busy schedule. Just for the audience, can you explain your role as the CEO of APHA?
Yeah, so as the Executive Vice President and CEO of APHA, I'm really the CEO like CEOs of any company. So I'm responsible for strategy and vision and implementation and really everything that goes on here at the American Pharmacists Association.
So prior to being at the APHA, you were at Cleveland Clinic, the Chief Pharmacy Officer at Cleveland Clinic. What ultimately wanted you to become CEO at APHA?
Nima, that's a great question. So as the Chief Pharmacy Officer at the Cleveland Clinic, who once again, the national rankings just came out from U.S. News and World Report this week, and they were number 2 health system in the U.S. and I would argue globally. And so we had a pretty big reach. While most of our hospitals were in Northeast Ohio, we really have, again, kind of a global reach. So we have 5 hospitals in Florida. We have facilities in Canada and Toronto. Cleveland Clinic Abu Dhabi has been open for, I don't know exactly how many years, 7 years now. And we're building a hospital in London. It was a pretty significant job. We had a $1.4 billion drug budget, and I had somewhere around 1,550 pharmacy employees. So it was a big job. And I really enjoyed it. I think, quite honestly, Nima, for what I did for being a chief pharmacy officer, I really believe it was truly the best job in the world to be a chief pharmacy officer. And the former CEO, Toby Cosgrove, who's probably one of the most widely recognized CEOs in the last 20 years from a health system perspective, Toby gave me a pretty long leash. He allowed me to be pretty active in the media on topics such as egregious drug price increases, problems with PBMs, and drug shortages. So I was able to do a lot of advocacy, and I enjoyed that. I do a lot of mentoring for young leaders and some older leaders. And one of the things I always tell them is that you don't want to forget where your paycheck comes from. Because while I enjoyed the advocacy, that wasn't really what I was paid to do. We had to safely and efficiently get drugs to patients and make sure that our pharmacists perform the clinical services to keep them healthy, to reduce costs and improve quality. The advocacy was something I enjoyed. And I really think more than most, I was able to leverage, I kind of used the pulpit of the Cleveland Clinic to do societal good, to talk about important issues. And I thought I was doing a pretty good job with that. Wasn't looking for a job. And then the American Pharmacists Association called. And I thought, what if it was my day job, right? What if I actually got paid to do what I enjoy most, to advocate and to drive practice forward and to help empower pharmacists to care for patients, to have a really national and international stage, broader than what I had at the clinic, to do good for society. So, I thought pretty hard about it. And I thought really the question came down to where could I do the most good? And I tell you, when I really decided was when on the final round of interviews, I was interviewing them and they were interviewing me. I wasn't sure I wanted the job. They weren't sure they wanted me. When I met the board of directors, and it was clear to me that they were looking for bold transformation in pharmacy, to really change things and not look at status quo. And they're a brilliant group who's incredibly supportive. So that sealed the deal for me. And that is why I came to the American Pharmacists Association. Really, I believe this is the best platform for me to improve healthcare for society.
That's all. Well, you've done a great job so far.
So you've alluded to advocacy a lot. And so in your new role as CEO of APHA, what are some of the things you would like to accomplish starting out?
I really think the biggest thing holding pharmacists back globally is payment reform. Okay, and you've probably heard that in terms of provider status. And so pharmacists, especially in community pharmacy, the deck is stacked against them. The reimbursement mechanisms are flawed. Recently, Ellen Gabler at the New York Times has done some articles, one in January, Chaos in Chain Pharmacies, one recently, how CVS was fined in Oklahoma for medication errors. And it really focuses on the fact that our pharmacists in high volume stores don't have very humane conditions, and because the reimbursement is based on product, and because PBMs or pharmacy benefit management companies have sucked all the profit out of the system, really without providing much value at all, that it's really just a factory, manning the drive-through and high volume, and created a bad environment. So what we need to do is not pay pharmacists for dispensing product. I mean, we can do that, but we need to augment that. And we need to pay pharmacists for doing what we all went to school for, what you're going to school for. And that's to manage patients' drug therapy. And we are, I'm preaching to the choir here, but, we're the second highest educated profession after physicians. Every pharmacist since 1999 has a doctor of pharmacy degree, and anyone that graduated before then has got decades of experience, the veterans taking care of patients. So I see it as three-tiered. Provider status is what pharmacists talk about, and that means with the federal government, which is Medicare, being able to have billing codes so that we can do things like, manage your mom's diabetes. So that's nirvana for provider status. Right now, we're looking for more minimum just to get started to help us. Pharmacists, they're 90% of the population lives within 5 miles of pharmacy. The administration wants to expand COVID testing. The best way to do that is to pay pharmacists enough. I mean, we're not trying to make a bunch of money, but we're trying to not go broke. Something like 5,000 pharmacies closed in the last 10 years. I'm from Ohio most recently, and 300 pharmacies, community pharmacies, closed in the last, I think, 2 years. Don't quote me on that, but it's directionally accurate because the reimbursement's wrong. So pharmacists get paid to do things like COVID testing. They can't lose money. Right now, they would lose money if they did COVID testing. Then we could dramatically expand COVID testing and help this pandemic get under control. So we have a focused ask right now in the next stimulus package. It's called the HEALS Act out of the Senate, and we don't have it in there right now, so we're fighting. So folks, listen to this podcast, talk to your senators, talk to your congresspeople to make sure that COVID testing for pharmacists is in there. That's the federal government. Then there's the states, right? Medicaid is administered by the states. Again, there are a lot of really good states doing great stuff. Because I was in Ohio for the last 9 years and worked with the Ohio Pharmacists Association, I quote them a lot and the things they do because I know it, and I help them to move things forward. But they got provider status under Medicaid, right? So they're still, the state's been slow, the governor's on them, and Ohio Pharmacists Association is fighting hard to make sure we pass the law, but now we can get pharmacists paid. That's the state level. So we're fighting at the federal level. Okay, we're fighting at the state level. Another thing in Ohio and other states is getting private insurers to pay. You don't need to pass a law for that. Again, I apologize for my Ohio bias. That's what I know. They've got United Healthcare and Centene paying pharmacists to do clinical functions. And guess what? We know when you do that, overall costs go down, right? So the insurance companies are actually saving money because people aren't getting their feet cut off, from diabetes. We're not having admissions for heart failure. So that's the model. So the question, I'm sorry, that was a very long answer to a short question. The biggest issue we are focusing on is payment reform. The second biggest is, incredibly important for our community pharmacists, is the PBM reform. DIR fees are just killing community pharmacies. In 2019, I had 19 community pharmacies and a specialty pharmacy at Cleveland Clinic, and the PBM stole $6.5 million from the Cleveland Clinic, post-adjudication, where you get paid at point of sale, and then they come back with some phony quality metrics that have nothing to do with patients, and they just steal from community pharmacies. It should absolutely be illegal. So those are the big issues that we're having.
You spoke about payment reform and PBM reforms. We all know that things aren't going to get done unless they are passed in legislation. So what is your plan, APHA's plan, on getting these things passed in legislation? Because you have to lobby for your profession. That's the only way things are going to happen.
Absolutely. And we're lobbying hard, and we're actually part of a coalition. Pharmacy is in lockstep on this. All the major national pharmacy organizations work together. We have weekly calls. We have strategy. We're lobbying hard. The immediate ask, is to get it into the stimulus bill for the next coronavirus stimulus. So we're fighting hard. You've probably seen the grassroots advocacy. If you haven't, go to APHA's homepage. It's super easy. You just got to put your name and address in. It will send letters to your Congress people and senators. So that, we're, and if you follow me on social media and APHA, we're pushing hard right now for, I call it mini provider status, right? It's coronavirus to do testing and immunizations, right? So at least we would create billing codes, we would have precedent, and we would be able to expand on that. We tried for everything all at once. I'd like that. Oh my God, I like that. But we are willing to take steps that move in the right direction. Rome wasn't built in a day, so this is our current strategy. But we're lobbying hard. We're fighting hard for our pharmacists.
So I got two questions for you. Out of all that, I got a lot of questions for you from all that. But for the first one I want to ask you is in regards to the HEALS Act you mentioned. So Chuck Schumer in Congress, let's say, and even AMA, they're not really supportive of pharmacists. And I've seen you express yourself on LinkedIn a lot in regards to that. Why do you think that is? Why do you think that we're not being recognized as healthcare professionals, as people that are capable of, working at the top of our license, even in government and even with our fellow healthcare professional organizations such as AMA? Yeah,
well, with that, especially in my previous role at Cleveland Clinic, we worked with our physicians, and our physicians were our biggest advocate, So in team-based interdisciplinary care, right, we're all a team. The physician's a quarterback, right? Yeah. They've got a dietitian, they've got a pharmacist, they've got nurses, and physicians in health systems really understand that, and they're trained when they go on rounds, with pharmacy students, right, with yourselves. They're rounding as medical students with pharmacy students. They understand interdisciplinary care. Now, the AMA has historically represented more of the independent physician practices. Okay, and that's a tough business, right? When I was at Cleveland Clinic, my little brother, who was not at Cleveland Clinic, is in northern Michigan, and he was had a small group practice. It's really hard, right? I mean, the investments you have to make in electronic health record, the bureaucracy, they make it tough to make a business, they being the government and everything else. He wound up selling his practice, and now he's able to focus more on patients and not have to do the business. I mean, he misses a lot of that, of course, but so many physicians have had to do that. So the independent the independent physician practice is shrinking, but that's historically their members. And that group can see things from a pie perspective. They're concerned, they believe that there's only so much pie, and that if another discipline is getting the pie, then they have less pie. Now, with coronavirus testing, there's too much pie, right? We have a huge need. My son, he's doing rotations. He's a pharmacy student in his 4th year, and one of the technicians on rotation had positive for corona. He had to get a test. It took 2 weeks to get his results, right? So we don't have enough testing. If physicians want to do all the testing, they can't, okay? Now the AMA had historically sort of opposed this. We've talked to them, and we understand that they are going to potentially go neutral, where they would not lobby against this. For us, that would be a win. AMA is a powerful lobbying group. All your listeners need to donate to the APHA PAC so we can be a powerful lobbying group and have the influence of the AMA. We don't, okay? So they've got deep pockets, and you need those to succeed in lobbying. So we hope our partners at the American Medical Association listen to their members. Physicians get interdisciplinary care. You can't argue that expanding testing, they're losing argument, right? If they want to go on public and talk on the news about not allowing pharmacists to expand COVID coverage, you can't justify that. It boggles my mind. It defies logic. You could have that argument. So hopefully the AMA is not going to be a barrier to helping us get through this pandemic. Schumer, I'm not sure why we had that language in it. We've heard that it was pulled out. Now, part of that may be that it wasn't scored yet. This gets kind of complicated by the Congressional Budget Office, but we are applying pressure. So all your folks need, hey, if they're in Schumer's area for sure, but really all of Congress needs to know how important it is, because this helps society, right? I mean, you can't argue against expanding testing, right? Is it going to cost more? Well, it's only going to cost more because we're doing more testing. You got to pay someone to do testing. It's not going to cost more for us to do it than physicians or anyone else. It will cost more because it needs to cost more because we need to dramatically expand testing. But the offsets, right, to society, if we can reopen the economy, if we can get things going, if we can not have people admitted to the hospital on ventilators for COVID, are earth-shattering, the difference that we can make.
If you were sitting in front of Chuck Schumer right now, what would you ask him?
I would ask him why he is potentially not allowing the dramatic expansion of COVID testing by putting pharmacists in. Again, 90% of the population within 5 miles of a pharmacy. And you look at the issues with racial disparities, right, which is a huge issue in our country that's been highlighted. COVID is dramatically impacting communities of color worse than other communities. Oftentimes, there aren't even physicians' offices in those areas, right? There are still pharmacies, right? So by having that access, we help the racial disparities. Chuck, you got to do this, brother. I mean, this is so apparent. Wake up and help us. Help us help the U.S. population by expanding. Help us help underserved areas. Help us get the economy going by having pharmacists do COVID testing. Put us in, coach. We're ready to go.
Go ahead, Nima.
You mentioned donating to APHA and how, that would help a lot. And you mentioned DIR fees. So to me, when I hear those things, it's about business, money, you need money to move things around. And that's where the DIR fees come in. And that's where like the CEOs of the big corporations come in. So do you think there's a mix up of maybe the higher ups of the pharmacies, the CEOs of the CVS's, Walgreens, whatever it is, all these organizations don't really understand what we as pharmacists deal with inside the stores? There was a letter that was sent from a bunch of pharmacists to the pharmacy boards, and then there was an interview in the Times, and the pharmacists said, I quote, "They struggle to keep up with an increasing number of tasks, filling prescriptions, giving flu shots, tending the drive-through, answering phone calls with patients while racing to meet corporate performance metrics." They're worried about the metrics because that's how they're going to keep their jobs. So what is your response to that? Like, what do you think? There's a little separation between business and really what's going on, what we need to do as pharmacists to be able to practice that top of our license.
Yeah, well, it's in this country, we are a market-based economy, and that's what we're in. So it is about business, right? You have to, in order to succeed as an organization, you have to have a business model that brings in more revenue than expenses. Otherwise, you don't feed your family, you can't send your kids. I mean, we're in a capitalist society. So what we need to do is have proper incentives, right? So that pharmacists are graded on keeping patients healthy, and that's not how they're graded with corporate metrics. So you can align our capitalistic society with benevolence, right? But it's all about payment. What I started with, it's all about payment reform. You have to incent companies to do the right thing. Okay, masks is an example. There was a terrible shortage of masks, right? It's probably not completely alleviated, but you can get masks now in a lot of the country. Now, maybe not N95s and all, but you couldn't even get cheap surgical masks. Now you pay more for them now, but you can get them because companies are incented, right? Because they can sell them. In a capitalist society, we have to pay for things that provide value, and counting by 5 as fast as you can and manning a drive-through don't provide value to society. So, Ellen Gabler was absolutely right when she interviewed pharmacists and technicians. Our technicians are in the same situation. So APHA is going to call balls and strikes. Okay, so when someone's doing something bad, when Caremark and other PBMs suck billions of dollars out of the health system without providing any real value, that's bad. Now, Walgreens recently decided to close pharmacies for a half hour to make sure pharmacists and technicians can get lunch. Now, that's a pretty low bar, right? Okay, you get a half hour lunch. So, I mean, it's not like, that's the best deal in the whole world, but compared to not drinking any coffee in the morning because you don't have time to pee, right? That you don't get a break, that maybe you can inhale your sandwich in between patients. So we're thankful to Walgreens, right? We're calling them out. I've done that on social media saying they're doing the right thing. CVS, you should probably step up and do the same thing. But so that we're calling out good behavior. We're not just going after bad behavior, which we're going to do. APHA is taking tough stances because I guess, quite frankly, we were rightly or wrongly sort of accused of being kind of vanilla and not worried about ruffling feathers. Hey, we're going to ruffle feathers. If feathers should be ruffled, we're going to talk about the issues that are important to members. Now,
we've spoken about interprofessional relationships with AMA, getting payment reform, things like that. Now, what do we need to do as pharmacists? Because at the end of the day, it's going to start with us. What do we need to do as a group to make sure that these things move forward? Because the pulse of the pharmacy community is some pharmacists care and some don't. So what do we need to do as pharmacists?
The outpouring of support. I did a podcast with Todd Urey at Pharmacy Podcast Network, I don't know, roughly a week ago, a couple Saturdays ago. And it came out of the Ellen Gabler article. And so we went on, we talked about the payment reform issues, took on issues really head on. I tell you, the outpouring of pharmacists through social media, through email has been incredible. I challenged at the end, I said, a lot of people want to throw stones and they'll say, APHA isn't doing anything. Well, we are doing things, and I think APHA has always done things. They weren't very good at honking their own horn, but we are taking aggressive stances, and we've had hundreds of people sign up to APHA. I challenged at the end, I said, if you want to throw stones, you're part of the problem. Okay, if you want to help us, join APHA and be part of the solution. And people are responding to that. So joining APHA is a great way to do it. Contributing to our political action committee or our PAC gives us the ability to help in the lobbying front. So those are things we can do. And then doing the grassroots, okay? We've had calls. So contract, the grassroots is easy with our software, but if you have legislators, that or your friends know. The other thing, I did a call on social media to our physician partners, okay? You work with physicians every day. Physicians love interdisciplinary care. They understand the value and they understand the value of their dietitian, right? And they understand team-based care. Get your physicians to help advocate, to help pharmacists, help them successful, because it's a team, right? It's when pharmacy is successful, when dietitians are successful, dietitians, right? They help people with their weight. They don't have diabetes, they don't have issues, hypertension. Pharmacists, we help comply with their medicine. The scores are better for our physicians, quality improves, and overall costs go down. So advocate, with legislators, work with your medical staff to get them to support us, contribute, be a member of APHA, because if you can't tell, we're fighting from this conversation. APHA is fighting for members. We're fighting for members in our community, right? It's a tough business being a community pharmacist. 5,000 pharmacies closed in the last 10 years. We're fighting for our chain pharmacists, right? These folks are in inhumane working conditions sometimes. We're fighting for them. We're fighting for our health system pharmacists, okay? So provider status is gonna help health systems. Join APHA, contribute to our PAC, talk to your legislators, talk to your physician friends.
What do you say to the pharmacists that would be part of APHA or any other pharmacy organization if there was no fee to be involved? Because I know they're making hundreds of $1,000s a year, right? So it's like, what's a couple $100s from that? Contribute to your profession. But
and on that, they have to understand the value proposition, right? They can't be successful, okay, if laws aren't changed, if the public isn't educated, right? And maybe they can do that on their own. I doubt it. When we band together, when we work together, we have a much stronger voice. So pharmacists make good salaries, right? Right now, there's a bit of an oversupply. A while back, there was an undersupply. Salaries have gone up dramatically over the last decade or two. Pharmacists have a great opportunity to have a profession because advocacy's happened in the past. We will not have a great profession in the future if we don't have advocacy. If you're not part of the solution, you're part of the problem, right? If you're not supporting professional associations, then you are partially responsible for the demise of the pharmacy profession, right? You can be responsible for improving care for patients, all about patients. We're pharmacists, we look at that through the lens of pharmacy. You can be responsible for driving practice forward like I am every day of my life, like you are by doing this podcast, or you can be part of the problem. Where are you gonna go? You can be part of the problem, you can be part of the solution. A lot of people lately have said, you know what? I like the direction. APHA is fighting for us. We're gonna be part of the solution.
I think one thing you mentioned before you said that like APHA was doing a lot prior to you being CEO, but they weren't putting it out there. And I think that's one thing you do that's you do a good job at that. And through LinkedIn, you're very vocal. You're out there. You're letting people know what APHA is doing and what their thought process is. How has being on LinkedIn, on social media in general, helped out so far by you being so interactive on there?
It's given us a tremendous venue, So, and I've always done this. So when I was at Cleveland Clinic, I used social media. Back then, I was primarily on egregious drug price increases, drug shortages, and PBM reform, and able to sort of get the word out. Now, when I was at Cleveland Clinic, I couldn't speak as freely. I was given a pretty long leash. Now, I can do whatever I want. I mean, I got a board of directors, but they're passionate about this too. I've always said, when I was the chief pharmacy officer, and now I was the chief pharmacy officer, I'm the chief executive officer, I'm also the chief marketing officer. If nobody knows, it didn't happen. If nobody knows about it, it didn't happen, right? So we're working our butts off. I got an incredibly dedicated team in government affairs and practice and education, and we're gonna let the world know what we're doing. And I tell you what, the outpouring has been incredible. I mean, go on LinkedIn, look at the comments, and then I'm getting messaged by people who are saying, oh my God, I'm joining APHA, or I got an email from a guy in Florida the other day, said, I listened to your podcast, and you know what? I was one of those pharmacists. You called us out for not being members. He not only joined APHA, but he sent a $500 check to the PAC. So social media has been an incredible venue for us, and I think it's really helping get the word out. We're firing up the troops. People know that APHA is fighting for them, and they're coming along. A lot of people, on LinkedIn and Twitter said they were joining. I thought, oh, that's easy to say. I checked the numbers. Hundreds of people. They're actually logging in with their credit card, and they're saying, we are going to fight with APHA for the future of our profession. So in summary, that was a very long answer to a short question. Social media has been a great opportunity for us.
Yeah, I think having that, being able to have that connection with your leader, I think that's what makes people motivated to move on and keep going forward. Even if you work at a big corporation, when you see a CEO of your corporation so, you know, active and you see them working so hard, I think it makes you push. So I love what you're doing with that.
Thank you.
So patients having access to affordable drug therapy, I mean, that's been something we have been dealing with since before we were probably even born. So what are you doing to help that? I know that's a loaded question, but what is APHA doing? What are you doing to make sure that patients around the country are having affordable access to care?
Yeah, well, I mean, the first, I would start that because there's two things. There's care, right? And then there's medications, which are part of care. So the biggest thing we're doing with care is making sure that our pharmacists are able to provide care, right? So if our pharmacists can't provide care, if we can't expand testing, if we can't get reimbursed for managing your mom's diabetes, then that limits care. You know, drug prices are an incredibly complex topic. I've been very outspoken on that in the past, and we will continue to call balls and strikes, Aaron. So, you know, historically, Valiant Pharmaceuticals, the egregious price increase being in the media started in 2015. And that started with me and with Erin Fox, who is a pharmacy patriot at the University of Utah. And she runs the drug shortage center there that populates the ASHP website. She is a dedicated APHA member as well. I got a call from a reporter at the Wall Street Journal in maybe late 2014, Ed Silverman, who now runs the Stat blog. And he said, hey, Scott, have you seen an increase in price of nitroprusside and isoproterenol? I said, heck yes, we're at the Cleveland Clinic, the #1 heart hospital in the world for, I don't know, 27 years. We use a line of nitroprusside. And so I ran the numbers and the math, and don't quote me on the math, but I said, if we use the same amount, because they jacked the price up, you know, like, I don't know, 500-800%. So we use the same amount of nitroprusside and isoproterenol this year we did last year. It cost, I think it was $11 million. So like at one hospital, $11 million, these egregious price increases. So that kicked off a flurry of activity. Okay, you remember Martin Scarelli with Daraprim, PharmaBro, 5,000%. We were all over that in the media. Eventually Valiant, the company, they had Senate hearings about, and it's all about sole source generics. That's a little complicated to get into, but basically only one company made it, even though it was a generic. They bought it, and you could say the market will, you know, allow people, will make it. Yeah, but no one's got extra capacity, right? So some other drug companies can't start making it right away. They got to get a ANDA and, you know, get manufacturing capacity. So they basically had a monopoly. What happened to Valiant is they lost hundreds of millions of dollars in stock value. Their name became so toxic that they had to change their name to Bosch Pharmaceuticals now. So I learned from that experience that being in the media, you can really impact things like drug pricing. We don't see as much of that. For a while, that was a big thing, the sole source generics. So APHA will take that same stance. Now, there's nothing wrong in a capitalist society with pharmaceutical companies making money for drugs. We won't have innovation if we don't do it. I think the greatest example of that I can think of recently is Sovaldi, right? Actually cured Hep C. Now it was expensive, and I'm not sure if it was too expensive, what the societal value is. That was shocking because that came out as $1,000 a pill, $80,000 for a course of therapy. But guess what? It cured hepatitis, right? So it's a fine line where that value is. Now, something like Sovaldi, you can say, and there are other, you know, that was the first one. Some of these oncology agents cost hundreds of thousands of dollars. And, you know, I was the secretary for the P&T committee at Cleveland Clinic. And you get all this data and like, okay, for $400,000, and I'm making this up, but it's directionally accurate, I can get an extra month of life for a patient, maybe. Is that worth $400,000? You know, I don't know. So APHA will be looking at drug price issues with the caveat that pharmaceutical manufacturers, we wouldn't be able to do our jobs, manage medications, if there wasn't innovation in pharmaceuticals. So making a living making pharmaceuticals is not a bad thing. Making a killing off of egregious price increase is not a good thing. So we're going to be calling balls and strikes in that area too.
Well, a lot of the topics that APHA is trying to attack can't be done alone. You know, you need a well-rounded team. And when we talked to Dr. Barsoom, Dr. Kernan, that, you know, teamwork was great at Cleveland Clinic. And so I'm sure you came in with a strategy in mind when you came to APHA. How did you form your team, and how important is it for you to have a well-rounded team?
You know, that's really good. And Bill is fantastic. You know, Bill was a clinician, and then he was a manager. He was a director at Weston. When we bought other hospitals, we became a mini system in Florida. I immediately promoted Bill to be the system executive director of Florida because he's done such a great job. Will Barsoom is a good friend and was a great CEO. He's moved on to industry, but it's all about a team, and Bill was part of that team. At the Cleveland Clinic, we developed an incredible team, and I honestly believe that we had the highest performing pharmacy enterprise on earth. And what we did is, you know, we kind of took Cleveland Clinic from good to great, and that's what I'm going to do at APHA. We've got a very good organization. We can make it great, and that's by getting teamwork, by getting the right people on the bus. I got somewhere I got my Good to Great book. I don't see it here on the shelf, but that's kind of my favorite one. You know, how do you take an organization from good to great? What we did is we broke down silos, right? Okay. When I got there, we had a director of operations, a director of clinical. They were turfy, they didn't talk together. We changed that. I put one person, Sam Calabrese, who replaced me now as the chief pharmacy officer. He's smarter and better looking than I am. He's going to take the place to great new heights. But we said, we got to get rid of the silos. I got everyone around the table. And the left hand knew what the right hand was taking. It used to be we had our community pharmacies, they didn't talk to the inpatient folks. Our employee health plan didn't talk to either one of them. Our clinical people didn't talk to operations. I said, that's not okay. Okay, we're all Cleveland Clinic, we have patients. Doing the same thing at APHA. I did a pretty major organizational structural change last Tuesday, okay? I interviewed every employee, we had 130 of them. I interviewed every employee. I had a one-on-one meeting through Zoom or Skype or Teams. And spent a half hour with everybody and want to know what's working, what's not. The group, you know, what I learned is, oh my God, we have dedicated, high-performing people here. They were very honest. They're like, Scott, we have some issues culturally. Okay, there's silos, people don't work together. We've restructured the organization in a way that will eliminate silos. No one, when I was at Cleveland Clinic and Pharmacy, picked up the phone and said, if it was a medication, that's not my problem. They would say, hey, I'm not the expert on that, but I'm going to get Mandy Leonard, you know, in formulary to take care of that, or I'm going to get Jeff Schmidt in the employee health plan. And we worked as a unit, okay? We're doing the same thing here. No one's going to get a call at APHA and say, that's not my job. Not that they did that before, but any organization has got structure, right? And you've got to have the right structure and hold people accountable for doing the right things. You know, again, amazing team around here. So people are so dedicated. You know, I interview them one-on-one, and almost every one of them, I said, what do you love about APHA? And non-pharmacists, everything, we're doing good for patients. I come to work, we're not just making widgets, right? We're improving the health of the communities we serve. This group's dedicated. My job is to empower them, to take barriers out of the way and turn them loose. That's what I did at Cleveland Clinic. That's what we're doing at APHA.
Yeah, you just mentioned, you know, you're helping the community. I was about to ask you, how important is it for you and APHA to give back to the community, and how are you currently doing that?
You know, everything we do, Aaron, is about giving back to the community. And that doesn't mean necessarily writing checks to everybody, right? We give back to the community by advancing practice, by, you know, when I interviewed for this, I said, what does APHA need to do? And to me, I came up with a little tagline, and I still use it. APHA is about empowering pharmacists to care for patients, right? So everything we do, and our pharmacy technicians, but we empower them, and we empower our communities are stronger when they have successful community pharmacies. Our communities are healthier when pharmacists are working in interdisciplinary teams. Racial disparities in health go down when pharmacists are able to help communities of color and underserved areas. So, you know, it's not about writing checks to community organizations, right? And you know, quite honestly, the pandemic has impacted every organization. So every organization on earth, I mean, some, I guess if you're in video technology, you're doing really good, your stock value's up, right? Amazon's delivering a lot of stuff. This is probably good for Amazon, but it's not for a lot of organizations. And so we need to look at everything we're doing and run APHA like a benevolent business. You can't just be benevolent, right? Because if you're just giving stuff away, you go broke. In hospitals, which are mostly nonprofit, we have a term that's, you know, we always like to say, yeah, we're nonprofit. That just means it doesn't go to shareholders. If you don't reinvest, if you don't hire good doctors and pharmacists in the hospital, you can't be successful. So you know, in hospitals, it's say no margin, no mission. You can't do your mission if you don't have a healthy bottom line. I can't hire more lobbyists. I can't hire more people in practice to help develop community pharmacy residencies unless we run the place like a business. That's not a cutthroat business, right? But so what are we doing for our communities is, you know, fighting every day to make pharmacists, to empower them to care for patients.
What is your message to all the pharmacy managers, district, regional managers in retail, the chief pharmacy officers at hospitals? What is your message to them right now?
It's the same message, right? Be part of the solution, okay? I'm a former chief, I'm a recovering chief pharmacy officer. I enjoyed that job tremendously. You know, APHA is going to reach out. That's an area where potentially APHA hadn't been particularly strong. You know, I know these folks, and I like to think when I was at the Cleveland Clinic, I was really the APHA of hospitals because I represented all of pharmacy, right? So I had 19 community pharmacies, I had a specialty pharmacy, I had a home infusion pharmacy, we had inpatient pharmacists, we had ambulatory pharmacists, we had specialists in oncology, and I managed them all. That's what we're doing at APHA. So we are the only organization that represents all pharmacy, right? And it's great to be members of multiple organizations, but we're the only ones looking out for the entire profession. And all of those folks, district managers, chief pharmacy officers, need to support our mission so that we can empower pharmacists to care for patients. The
first day that you sat in that seat, what did you think? What was in your mind?
I don't know if I can show it to you. I'm just gonna take a second. I'm sorry.
No problem.
Opening my blind here because my seat is pretty incredible. Okay, so I was humbled when I first sat in the seat. So I don't know if you can see this. I'm going to look at the screen. It might take a second to focus.
Yes.
Oh wow.
Yes.
Yeah.
You know what that is?
I do not.
That is the Lincoln Memorial. Okay.
Oh wow.
Over here, I can't change the blinds, and you might not be able to see it. But the Washington Monument is there and the Capitol. So the first day I sat in the seat, I had a tremendous sense of duty and obligation. The first time I walked into our storied marble building, so we have two buildings here. The original headquarters was built 1932 or 1936, designed by the same architect, Pope, that designed the Jefferson Memorial. I point there because I can see the Jefferson Memorial, and the National Archives. It's a shrine to pharmacy. It's the world home of pharmacy. You know, I walked in that building in the Hall of Flags and I thought, oh my God, I have such a sense of duty and obligation. We have the presidents going back to the 1800s, you know, they're much more diverse lately. It used to be just a bunch of old white guys, but you know, lately we're getting a diverse group of presidents. And I thought, the people who built this incredible, noble profession, I have an obligation to them. So not just looking at the past, but looking to the future. I am a steward of the profession of pharmacy. We have the world home, and all you guys need to come out here. And then behind it, we have this big, beautiful building, and I have this balcony overlook. We rent it out for weddings and 4th of July fireworks and all that, because it's incredible. John Gans, 2 CEOs ago, built this beautiful building that allows us, it was the only privately owned building on the National Mall. Everything else is government. We have the only building. It's special. Come here and take a selfie out with the Lincoln. This is your home. This is the home of all of pharmacy. So the first day I sat in this desk, I looked out there and said, oh my God, I need to, every minute of my life needs to be dedicated to this profession. You know, and we got some tough times. We got a pandemic, right? I look out at Lake and I'm like, there's a civil war. I look over here at Washington, I'm like, independence, war of independence. We don't have it that bad. Okay, I'm not right. Not the pandemic's horrible, right? But these people had huge societal issues, right? So we can get through this. But when I sat in this desk, I said, I've been given an opportunity very few people are given in their lives, really to reach the maximum potential that I have for society. I'm a pharmacist, you know, I do that through pharmacy. So that was also a long answer to a short question.
No, that was a great answer. Thank you.
So what do you say to the person that's not in healthcare at all, to the lay person that sees everything going on? What can they do to help healthcare move forward, let pharmacy move forward, to get through this pandemic? Well, what do you say if somebody asks you, what can I do?
Well, there's a couple things. Now, all of them have moms, right? And their moms, you know, mine's 77. She's on a few medications. So think about your mom, right? And how can we help your mom? We can help your mom by managing medication therapy. You can help by understanding that pharmacists, their role in society and helping us advocate, you know, saying, I love my community pharmacy. If they were to close, my mom wouldn't be able to get her prescriptions. So the lay people need to understand what we do. And our value is really managing medication therapy. Patients are on 15 medications. They all interact. No one else. Physicians are great. They got a lot of training. They don't have as much pharmacology training as you do in pharmacy school, right? We are the medication experts. So let us do that. And right now, I'd say folks need to do their part in the pandemic with social distancing and being responsible. If we want to get this economy opened back up, we need to stop the spread and the transmission. So that's something everybody, all of us can do to help.
So looking at your CV, you're a very successful person and you're very successful in pharmacy. When was that time when you're just looking at yourself in the mirror and you were like, you know, I think I've made it?
Well, you know, looking there, I've always been happy with what I'm doing, Aaron, and I haven't been looking forward to the next thing. You know, when I was at Minnesota, I was the 5th pharmacy director in 6 years, so we had a lot of turnover. We stabilized that. The University of Minnesota Medical Center at Fairview became a nationally recognized pharmacy department again. I was happy. I wasn't looking for something the Cleveland Clinic called. So, you know, maybe it's when people call, right? When you're not looking for a job and they're like, hey, Cleveland Clinic called. You know, I wasn't looking for a job, they wanted me. APHA called, I wasn't looking for a job. So when you look objectively at that, I think maybe you can say, you know, hopefully it's successful, but it's not about me, right? It's about what I can contribute. So I feel, I guess to answer that, successful now because I've been given an opportunity to impact healthcare on really a global perspective. So right now I feel successful, but really successful for the profession and for society. It is not about me. I do not get up every day and say, God, I wonder how much money I can make. That's not it. I'm like, how many lives can I help improve? And I don't do it myself. I do it by empowering this amazing team here, by highlighting the great things our pharmacists are doing, like Beth Bryan in Tennessee, who you know, started doing COVID testing. She was losing money on it just because it was the right thing to do. Now we need to get Beth paid. You know, about all our entrepreneurs who do great things, and pharmacists who are getting into pharmacogenomics and you know, all the things we can do. So yeah, success to me is about positive impact on society. And I like to think that I'm maximizing my potential here.
For sure.
If you could speak to all of your past employees who worked with you or under you and your current employees, what message would you have to them?
You know, it'd be thank you, okay? Because it's not about the CEO. The CEO can help empower folks, right? My job is to remove barriers, to set the stage, to have strategy. I'm not the one that does all the work, right? I am not the one that does all. My staff, this amazing group of caregivers, are working their butts off every day. And you know what? Just like a lot of people in the country, they had to do it from home. They had to transition like that to working from home. We're having Zoom meetings and people's kids are crawling in their laps. It's cute, you know, but it's the reality is they can't send their kids to school right now. So I don't know when we're going to be able to open this amazing headquarters for folks. Probably not this fall, you know. So my past employees was thank you. Okay, thank you for creating an incredible organization at University of Minnesota Medical Center Fairview. Thank you for over 9 years taking the Cleveland Clinic pharmacy enterprise to be one of the greatest pharmacy enterprises on earth. When I got to the Cleveland Clinic was very well known. The pharmacy department wasn't. Now people know the pharmacy department of Cleveland Clinic has the same reputation as the rest. And that's because people were innovative, because they tried new things and weren't scared to fail. And now my current employees, hey, I'm trying hard. I'm reorganizing the department. I'm taking barriers out of the way. I'm letting our members know how hard you work for them every day. So 2 words to past and current employees: thank you.
So we like to ask this fun question to everyone that we interview. So if we were to go back to high school, undergrad, or even back to Cleveland Clinic, and we were to ask your fellow employees, like Aaron and I mentioned, your teachers, your friends, who was Dr. Knoer? What would they say?
You know, I would like to think they'd say, you know, Scott was a person with a lot of passion and energy and wanted to improve society. You know, I guess it probably depends on who you ask. I've ruffled a few feathers along the way. I'll probably ruffle a few more, you know, but, you know, I would hope they'd say, you know, through various stages of your career, you're more immature at sometimes, but I think I've always wanted to try to do the right thing. I'm not perfect. I screw up like everybody else. I'm a human being, but I think they'd say, Scott, I guess more than important, Scott tries to do the right thing, is what I honestly think people would say. Some may not agree with my tactics, right? I'm a little bold for some people, a little outspoken, but I think even those folks would say that I'm trying to do the right thing.
You've been a leader throughout your whole career. How has your leadership skills changed in the past, let's say like 10, 15 years?
You know, that's a great question. And they do. You mature. I mean, there's some, you know, okay, having your hair fall out isn't good. Getting old. But oh my God, the life experiences that you have, they just put things in perspective. There are very few things today that I see that I haven't seen before. So now nothing ruffles me, right? I mean, it's like, oh, we've had worse. You know, it's like, oh, that seems pretty scary to you. That's nothing crap I've dealt with before. So I think the biggest thing is perspective. And I think the other thing is, you know, our greatest strengths are our greatest weaknesses. I think my self-understanding of, you know, you start talking about strength finders or Myers-Briggs. I know myself. I know what I'm good at. I know what I'm not good at. You know, when I was younger, I'm pretty aggressive now, right? I mean, I think you probably tell that. I've toned it down a lot, right? And I've learned, I've always been aggressive, trying to do the right thing, but sometimes people can think you're kind of running over them to get it. And I am trying to get to a goal. The goal isn't for Scott. The goal is always for society. So spend a little bit more time trying to tell the story and make sure people understand. Because working with Scott, I always say with, because no one's working for me. Everyone at APHA is working for patients. They're working for pharmacists. They're working for society. They're working with me. No one works for me. They work with me. But working with me is sometimes not easy because we go 90 mile an hour every day. It never slows down. So celebrating successes. You know, the other thing that I think I've done a great, I enjoy the moment, right? I work hard. I mean, you know, Joe Janella, my CFO, and Dan Slott have been here. Joe was here at 5:30 yesterday morning. He left at 10 p.m. last night. That's not sustainable, right? You know, but I enjoy it. I enjoy, so, you know, I enjoy the ride. I enjoy every morning. I walk out on that patio and I have a cup of coffee with Joe. And we just say, we look at that and say, we got to do the right thing, right? We've been given this opportunity to do good. Very few people ever get. So, you know, that's just some of my thoughts related to that question.
So obviously we have a pandemic going on. you have, let's say, the NIH director and CDC director come to you and ask for your opinion on how to handle things and what we need to do moving forward. What is your answer to that?
You know the answer to this, right?
I know the answer.
I mean, if you don't know by now after this last hour, you tell me, Aaron, what do I tell NIH and CDC? What do I tell Fauci?
We need to get pharmacists involved so that we can push healthcare forward. And it's going to save them money and save everybody money and lead to better patient outcomes.
Aaron, you're hired.
You're hired. Yeah, I think you got a job at public relations at APHA. Yeah, but it's the same thing. It's right. Put us in, coach. Pharmacists are here. You want to fight this pandemic? Let us do testing. Let us do what we do. We're in every community. You know, we have the infrastructure. You want to dramatically expand testing? Here we are.
Is there an accomplishment that you achieved throughout your career that shaped your career?
You know, the accomplishments I have are team efforts, okay? I look at some of the significant things at the clinic. I think Aaron and I starting the spark that led to media paying attention to egregious drug pricing was pretty important. But, you know, so now I've only been on the job a month and 29 days. I think it's hard to make an impact. I can talk that I think members are excited, engaged. I haven't changed any laws yet, right? I'm working hard to do that. So I look at the things in the past. I think my commitment to education, you know, going from the clinic, we had 11 pharmacy residents when I got there. We had 64 when I left. I took what Bill Kernan and Ozzie Delgado did at Florida. I remember the first time I went to visit Florida, the first year I was here, it was of course in January or February because it was cold in Cleveland. You know, I went down and Ozzie, who's the COO, who's the number 2 person, is a pharmacist, all Cleveland Clinic, Florida, right? The number 2 guy used to be my pharmacy director, and now he's my brother from another mother, and he's the COO at all those 5 hospitals. But Ozzie says, hey, Scott, do you want to come meet with the students? And I thought, well, yeah, what would David Zills do? I don't know if you know David Zills. He's one of my mentors, and oh my God, he does great with students. So I thought, you know, at the time it was a 150-bed hospital. Granted, they do transplants, it's high acuity. I figured they have 3 or 4 students. They had like 18 students in a 150-bed hospital. I thought, wow, that's incredible. So I went back to the Ohio. I said, Ozzie's got as many students as you do in a 150-bed hospital. You got a 1,350-bed hospital. So we went from, in Ohio, about 320 API months to, I don't know, it was 12 or 1,500 API months. So we expanded education dramatically, okay, 1,200 API months. We expanded residencies dramatically, 11 to 64. We had the first Apotheca chemo robots on you know, in the US. So we did lots with IV robotics. We expanded practice. The other thing, I had the opportunity, and for students, I like to talk about a few universal truths. My former residents call them Scottisms. But you know, a couple things you got to do is have a bias for yes. That's a Scottish, right?
Yep. Dr. Kernan brought that up.
Success breeds success, right? So writing. Who'd have thought I'd be a writer? I don't know if you've read, I encourage you to. I wrote 2 articles that are relevant. Advocacy is a professional obligation, okay? And my web address, pharmacy is a calling. I mean, read that, it tells you why I am called to pharmacy. You know, but I think writing, I never knew I was a writer. I didn't write in high school, I didn't write in college. I started doing case studies. You know, I submitted them. And I had a bias for yes. They talked, you know, you guys are too young now, but we had the Practice Model Summit, ASHP, which was my former home. I always paid dues in APHA, but I was a hospital pharmacist, so I did that. They were talking about changing practice model. I'm like, you know what, Minnesota, we totally transformed the practice model. I was a benevolent opportunist. I define benevolent opportunism in the literature. It's in my advocacy paper. I said, they're doing this, let's write. We wrote it up, submitted it, it got published. Bill Zellmer, who is also a mentor of mine, a long-term editor-in-chief at AJHP, now does a lot with the Historical Society for, I forget the exact acronym for that. He called me and said, Scott, tells you how long it was. He said, you know, we're doing this new thing called podcasts. So, you know, it was a while back. And he said, Scott, you're a really good writer. I said, did Bill Zellmer just tell me I'm a good writer? So I had a bias for yes. I wrote something, and success breeds success. That got me invited. I was the closing plenary speaker on practice model change at the Practice Model Summit in Dallas in 2010. They asked me to be, and this is just for students, this is learning, this is how you're successful. That success breeds success. I wrote a good article, wrote a couple other articles. They asked me to be on the editorial board for the journal. I did a good job. I said, what do you got to do? They said, submit some articles, get your buddies to submit articles, talk about the journal. I did that. They then gave me my own column. They asked me to be contributing editor for pharmacy practice and created a column, Perspectives of the Chief Pharmacy Officer. Another one of my seminal articles was Stewardship of the Pharmacy Enterprise, right? It's a great read. How do you make it all work together? That's what I did at Cleveland Clinic. That's what I'm doing at APHA. So, I'm proud of the writing that I've been able to do. I think I've been able to influence, I'm proud of the teaching that I've done. I've done a lot of speaking globally. I think we've done a lot of good stuff there, but all I do is share what we've done. I used to share what we did at the Cleveland Clinic. I used to share what we did in Minnesota. So how do we, share what we've done? So there's so many firsts, so many cool. When I got to the clinic, we had 2 pharmacists embedded in ambulatory clinics. When I left, we had 29. So we dramatically expanded it. We drove service. We looked at technology and automation. And the most important thing, I look at Sam Calabrese. Sam replaced me. When I got there, he'd never given a presentation. He'd never given an article. Now he's the chief pharmacy officer at Cleveland Clinic. I helped unleash him. When I got there, I said, my network's your network. He's chair or immediate past chair of the section of pharmacy practice managers. He's spoken internationally. He's written. There's so many success stories of people that I've helped empower, right? I didn't create them. I unleashed them.
Yeah. Well, I know you're a busy man, and we could talk to you for hours and hours. So we want to both appreciate you for coming in. Everyone asks us all the time, who's your audience for the podcast? And we're like, anyone in healthcare, students or pharmacists or physicians or anyone. And I think we did a pretty good job on being able to, provide that enough information for all those people. So the students motivated to push hard, want to one day maybe be a CEO APHA, be a leader in your profession. The pharmacists to, help you APHA, be part of APHA, contribute to your profession. And for everyone else, the physician and nurses, to understand the importance of pharmacy and pharmacists. So we really appreciate you joining us for today. And if you have any last words for the audience.
No, that's just it. And it's important for your students to get involved, and remember those universal truths. There are rotations. You guys are looking for residencies. How do you do that? Have a bias for yes. The preceptor has a project. Yeah, I'll do that. Guess what happens next? They ask you to do the next thing. Maybe you get a poster out of it. Maybe you do a talk. Maybe you get a publication. But those are the 2 things for students and young leaders. Have a bias for yes, and success breeds success. Every day is a job interview, right? Every day is a job interview, right? Yes. You never know. I mean, you could found a new company and you could be looking for CEO in 10 years. I could be interviewing with you, right?
This could have been a job interview.
This could have been a job interview. It might be, right? I might work for you someday. I might pull up and you're like, yeah, I own this big tech company and I'm looking for someone who's got some passion. You never know, right? And you can be good on a rotation for a couple of days, when you're on, you can't, if you're looking to apply for a residency where you're at, if you're not a good person, you can't be good for a month. They're watching you every day. How do you act? How do you talk? Are you positive? Are you engaged? Do you volunteer for things? Every day is a job interview.
Well, I don't know. If the audience is not motivated by now at end this interview, I need to rewind it and watch it from the beginning. Dr. Knoer, thank you so much for joining us, and everybody that tuned in. My name is Nima.
My name is Aaron.
And thank you for accepting our invite.